Welcome, Dr. Ruchika. Welcome to yet another episode of Neocare's Pain Aid.
Hi, Dr. Akshay. Happy to be here and part of the podcast today. Let's get going.
Yeah, definitely. So, Doctor, my first question would be, what is chronic pain?
So, chronic pain is a type of pain which is persistent over weeks and months. Any pain that lasts for more than 3 months is maladaptive, is not functioning in any way for healing or getting better results, is called as chronic pain. So, sometimes pain will persist even after the initial cause of that pain has healed. So, that is chronic pain. So, pain lasting for more than 3 months.
Okay, and what would be chronic stress?
Chronic stress is a prolonged state of physiological arousal in response to certain stressors that will persist over time. So, these stresses may be physiological, these stresses may be emotional, these may be mental, and it may be just the pollution in the air, which is working as a stressor for you. So it has various factors. It could be work pressure, relationship problems, generalized health issues.
And how does chronic stress contribute to the chronic pain?
So chronic stress can exacerbate chronic pain. How? By keeping or increasing the inflammatory state existing in our body, by altering the pain perception, because it can work through certain parts of our brain and enhance the perception of pain, and by worsening the muscle conditions or the existing muscle tension and increasing pain. Stress also creates behavioral changes like poor sleep. So, if we have not slept, we fall prey to the vicious cycle where again the neurohormones won't be balanced, the metabolism will not be right, and pain will happen. Stress can also lead to unhealthy eating habits. Stress can also make us just go cocoon in a corner. So there is no physical activity, there is no movement in the body, and these things contribute to keeping the state of chronic pain in our body.
Oh, that makes a lot of sense. I can now correlate between the stress factors and pain that one goes through. And, doctor, can really chronic stress and pain be treated?
Oh, yes, definitely. Chronic pain is a management problem. It is a problem like diabetes, like hypertension, which are to be managed. So, if stress is the trigger and the associated with the condition of pain that is there with which one presents, then stress management also gets integrated in the brain rehabilitation program. And there are many modalities which are required to manage these things for optimal results: lifestyle changes, medications, physical therapy, certain drugs, certain type of psychotherapies, everything put together, something as simple as regular massages. So depending on each case, every patient is dynamic, every human being is dynamic. So based on their presentation, we design a complete rehab program and everyone can get out of it.
Oh, that's so helpful. I guess most of the answers for most of the queries are cleared with this.
Yeah, get
And
out of it means like learn to ride this horse, tame this horse.
yeah, that's still hopeful. So, what role does mental health play in dealing with chronic stress and pain, doctor?
So, mental health and chronic stress would be interconnected states. like anxiety, depression. They may contribute to stress or they may result from the pre-existing stress. These are best managed or dealt with by the psychotherapists, but it is very important that these things be addressed, whether through therapy or medication if required, to improve overall well being and get effective pain management.
Yeah, so mental health matters a lot.
Yes, it
Yeah,
does. It does.
I hope everyone takes this point into consideration.
And
And
consider brain as an organ, just like every other organ. If it is about heart function, everyone is freaking out that, oh my god, the next thing that's going to happen is a heart attack, so we must protect it. But everyone who is going through certain mental challenges, their brain is also at a verge of breaking out. We need support groups, we need lifestyle changes, and we need the acknowledgement as a first step of the fact that stress and mental health need to be addressed. We cannot wish away these things.
that's so true, doctor. But what does one do, or how can one cope up with this type of chronic stress and pain on a daily basis?
So, coping strategies are again customized from case to case, and these will include yoga, meditation, breathing exercises, conversations with a support group, readjustment of the daily day-to-day function. If somebody has a problem like fibromyalgia, we'll advise them that work with short spurts, take a break of 15 minutes, rest, and then this is called as pacing your activities, pace your activities appropriately, and seek professional help as and when required. Whenever we are talking about chronic pain and chronic stress, the key to change is taking responsibility of our own health, understanding the parameters which can be controlled and managed, and handle that part appropriately.
Okay, okay. And doctor, do you think there are any long-term consequences if it is left untreated?
So, for long term consequences, let's begin with the cardiovascular diseases, the dreaded heart problems. If we are going to keep body in a state of chronic stress, we are maintaining an internal state of inflammation, which is affecting every organ, every vital organ of human body, including the cardiovascular system. And because every organ starts getting affected, we will have a weakened immune system, because liver will also not function as effectively, and we can have more serious mental health disorders with time. And these are like long term things which we are looking at, but the day to day quality of life gets diminished. So, as time goes by, the quality of life will really fall down. And I feel वो बोलते हैं ना, जिंदगी और मौत तो ऊपर वाले के हाथ में है जानना, लेकिन how to live, we don't decide when we come, we can't decide when we have to leave, but we sure can decide and choose how to lead this life. So at the end of the day, it's all about making informed, responsible choices and living well.
Wow. And doctor, when it comes to stress, we hear a lot about a term called cortisol test often. What exactly is this cortisol and why is it so significant?
So cortisol is an anti-inflammatory that functions to move the glucose storehouse for energy, and it also modulates inflammation. This is one of the catabolic hormones which is produced by the kidneys, a part of kidneys, and it is released 2 times a day, with the blood levels of it peaking in the morning. So when we wake up and start functioning, it has a role to play. This is the hormone which maintains our blood glucose and provides us energy actively, and is an anti-inflammatory hormone. So, internal tissue damage, internal nerve damage that are always associated with inflammation do not happen. This is protective in nature when it's coming to that. So, it is a key player for the management of stress response. So, whenever there is a physiological or psychological stress response, the levels of cortisols will increase because body now needs a surge of energy. So, stress induced increase in the level of cortisol is adaptive. It's an adaptive human behavior for short term. But excessive secretion of cortisol is crippling both physically and psychologically.
Okay. And doctor, doctor, you told me something about physiologic stress response. What exactly is that?
So, a stressor will be an event or a stimulus which is creating a physiologic stress response, which is called a state of stress, or I'm very anxious, I'm feeling very stressed. When we say things like this, it's a physiological stress response. Stressor can be pain or non pain related. It may be financial troubles. It may be a mother in law, daughter in law fight, or it may be a parent scolding a child. So, the perception of uncontrollable or unpredictable environmental demands that will happen, that will exceed the coping strength or coping resources of an individual, is what will invoke a physiologic stress response. And this is where the dynamic nature of being human is reflected, because the same boss giving the same scolding to three different employees will have three different levels of response. Somebody can get into super anxious state, somebody will be completely unaffected. So this is what is unique about being human.
Okay. These days, we come across a lot of stress and pain management programs. Do you really think that stress management should be included in these programs, doctor?
Yes, the chronic stress does influence pain. The chronic reactivation of a sensitized stress response will exhaust the hypothalamic pituitary axis. Now, what are these numbo jumbo words? These numbo jumbo words mean that whenever we have stimulated, like if you are going to put your hands to tickle, a ticklish person will tickle. So, whenever a person who has a sensitized stress response chronically, but getting activate chronic reactivation of a sensitized stress response, so the balanced state of being human is maintained by an axis which is called as hypothalamic pituitary axis, HPA axis. This gets into poor functioning if we have chronic responses. So, this is the axis through which chronic stress and pain will get related. Whenever we'll see a case like this where there has been prolonged or excessive axis, HPA axis activation, we do suspect cortisol dysfunction, and this cortisol dysfunction will keep body in a state of inflammation, and this can take patients either towards pain or some patients towards depression. So, depending upon the presenting condition, the appropriate doctors will manage. But what is important is that a holistic management approach is used. The stressor, which was the fear based threat, which could be pain or non pain related, should be addressed. And there should be therapies. If I let's I'm a pain specialist, let's go with the part of the pain. The body will still have the sensitized fear based memory, howsoever well we have controlled the pain with the medications. So, for these patients to heal completely, it is very important that the healing part takes place at somatic level with the body itself. This is where exactly these books like Your Body Keeps the Score, or you have to release the soma, we have to reset the vagal tone, all these things are fitting in at this level and this part. So for complete health consciousness, overall management of the condition is important.
Doctor, before we wind up the session, can I ask you one last thing?
Sure.
I have been very curious to know about it. So, yours is a orofacial pain relief center. So, how do you manage stress and pain in your center? How does that work?
By establishing the diagnosis appropriately. Or facial pain is a field of diagnosis.
Okay.
We have to really understand from where the pain is coming in the patient. So if stress is we feel is a integrated part of the case, then we have psychiatrists, we have psychotherapists, we have counselors, and we have few of our patients who work with support groups and today help our patients. So all of these things are activated and we develop a complete rehabilitation program for our patients and try to help them find the quality of life once again.
Thank you so much for your invaluable expertise and guidance. And to all our listeners, thank you for tuning in to Neocare's Pain Podcast. Remember, by making conscious choices and embracing positive lifestyle changes, we can cultivate resilience and well being in our daily lives. Until next time, this is Dr. Akshay signing off. Take care and be well.